Ladies and gentlemen, welcome to an episode of Curbside Curiosity. I'm your host, Fran Murray. I interview movers and shakers, community stakeholders, and also experts in their field. Drum roll, please, for Dr. Donna Murray. Oh, we got the cymbals, too.
From my HBCU days at Howard University.
Okay, so what university are you at right now?
Oh my God. North Carolina A&T State University is where I'm on faculty right now. We got a brand spanking new program in the College of Health and Human Sciences.
Okay, Health and Human Sciences. This one started your career in the medical field. She's had clinics. She's worked for the big ones. Big hospitals, the small ones.
Yeah. Let me say this, first of all. Fran, people in this town thought that I had disappeared and moved away. Because when the clinic closed, people didn't see me. And so a lot of what I've been experiencing is, I thought you had left town. No, I just kind of shifted gears a little bit. Left clinical practice and went into graduate medical education. And so in 2014, I answered this call to start teaching in PA programs. Started at Lenore-Rhine, fast forward to a year ago, landed at North Carolina A&T State University, where we developed the first PA training program at an HBCU in the state of North Carolina.
That's huge, but you don't do anything small. She's married to medicine. You know they have that show Married to... She's married.
Literally.
Medicine is her kids. I mean, you have two beautiful sons.
Yes.
Yeah. We can never call them boys anymore because they've grown up.
30 and 33.
30 and 33.
Yeah. They were little when you met them.
But their gift is music.
Absolutely. Both of them.
Mommy's in medicine. The sons are in music.
Yeah.
That's good. Yeah. So I know what made you stop doing a clinic. That is that's 2-3 full-time jobs.
But it was a gift, both for me and to the community.
Okay.
And so sometimes you got to pack the gift up and take it somewhere else.
Did you hear that, ladies? Pack your gift up and move it on. That's some wise words. Yeah, so I wanted to get like beet juice and celery juice.
The healthy stuff.
But oh no, sweetie pie. You're going to be like the rest of us. You've got to pick some things out of there.
Okay, let's see.
Do you know what your friend first, my friend second, she calls this the bag of remembrance.
See what's in this
So we got
bag.
some avocado chips. I don't know. You know, whatever they don't eat, my guests don't eat, I eat at 11 o'clock at night. It is sad. Oh, Twix.
I told my patients, unless you got diabetes, chocolate's a vegetable. Chocolate is veggie.
Make that on a t-shirt.
That goes.
She got her Twix. Okay, what else would?
I love olives.
See, these are my people.
Oh, that's so sad.
Can't you eat like 20 olives in one sitting
that is
with
so
some good
sad.
cheese?
Oh my gosh, without cheese, without anything.
Except
well, a glass of some.
You want some
beverage.
chips to go with that? If you don't have diabetes. Okay, let's go over the numbers because I used to call Donna when I was working the midnight shift at the radio station. I'm like, say something. Let's talk medical. Where's
good old days?
What should the blood pressure be?
So there are new guidelines. Right?
What?
It used to be the
same body, different guy.
Classic 140 over 90. Below that, you were good. Now we like to see somewhere in the 130s over 70s or 80s. Healthier. Yeah, new guidelines.
Okay, is that for adults or is that for children?
That's for adults, of course.
But children.
So, I mean, your kids, you need to watch what they eat. I don't do pediatrics, so let me put that disclaimer out there. I was an adult medicine person. Strictly 18 to 60 plus. So I'll leave the pediatric guidelines to my peds friends.
Okay, because she has a lot of medical friends. All your friends become my friends because they're so nice. Women in the medical profession are so nice.
Yeah, we just kind of hang out together.
As far as healthcare is concerned, we have a program, a PA program. Tell our audience about it.
So, PA program at North Carolina A&T State University, brand spanking new, just received our accreditation from our national accrediting body. Will welcome our first cohort in the fall of this year. They are calling themselves the Groundbreakers. Yay! And so this group of 21 young people will be joining us, and they will spend the next 27 months training to be physician assistants. So when they finish school, they'll be able to do all kinds of amazing things in healthcare in just about any discipline that they choose. So if they like children, they can do pediatrics. If they want to go into surgery, they can go into surgery, be first assist in the operating room. If they want to do specialties like gastroenterology or, let's say, plastics and dermatology, they can go into those areas as well. And then there's always primary care. If you're doing primary care the right way, your patients won't end up in the emergency room or in the hospital. The PA profession is a young profession, relatively speaking, but it is hot and highly sought after. And so, although I've been in the field for 29 years, the PA profession has been around since the late 60s, early 70s, right? And so these young people have gotten exposure in healthcare places and spaces, either with a background as certified nursing assistants or EMTs or paramedics or working as scribes, exposure in the emergency department or in primary care settings. And with the exposure, they made the decision, watching PAs and watching MDs and watching nurse practitioners and watching nurses and other people in the healthcare space, that the PA profession was it for them.
Oh, what's a scribe? This is a test.
So scribes are the neatest people that you would want to embrace in the healthcare setting. If you're fortunate enough to have a scribe in your clinic or in the emergency department, they actually take your notes for you while you are seeing your patient, so you don't have to write and see the patient and talk to them at the same time.
There was a lot of pressure on the medical professionals. It's like you have a certain amount of people you have to see. You only have 7 minutes to do it, and you have to do it with care. Really? How's that going to work?
So the scribes now take up the slack, and they do the notes for you while you're talking to your patient.
I love that. Yeah. In the pulmonary field is a big one too, but I don't know if the PAs do it.
We do it all. Anywhere you find physicians, you find us. Anywhere.
And PAs can start their own practice.
Yes, indeed. In the state of North Carolina and some other states, we can. We work in collaboration, of course, with a physician. You know who my supervising doc was. Can I call her out?
Yes, please.
Can I call her out? Dr. Valencia Covington, who I've been attached at the hip with forever. She was my supervising doc and medical director for my clinic when it was open.
Wow, that's a loving kind of profession. I mean, everybody has a loving profession, but the medical profession, you seem to have this bond, but then you come in with an open heart.
Yeah, there's always a connection. The thing that connected me and Dr. Covington was this like mind around service, right? She was the medical director at C.W. Williams at that time, and we both had this real attraction to taking care of the underserved. She did it in her way, and I chose to do it in the way that I chose to do it.
I love it. Hey, girl. We should get her in the car, too.
Yes, we should. She's doing some different things right now, but we can call her. We can call her up.
These women are so multifaceted, so many layers and flavors. What's a day look like for you?
Well, days in PA education look a little bit different than they do in clinical practice, right? Because what you are doing is you are preparing most days to be in the classroom with your students, or preparing to go through the admissions process, as I am in charge of for the program, to get new students to come into your program. And so it can look like administrative type things, or it can look like one-on-one with students, or it can look like 21-on-1 in a classroom setting.
Right.
And so at North Carolina A&T, we are going to be welcoming these 21 young people in the fall, and we will have them starting out in the classroom. They'll be doing lectures. They'll be participating in lab sessions. They'll be doing physical exams on each other and on standardized patients. And of course, I'm not the only faculty member that'll be there supporting them. I want to shout out my program director, Dr. Nicole Burwell. Yay!
Hey!
So Nicole comes to North Carolina originally from the DMV, but she practiced clinically and worked in PA education out in Stanford for a number of years. Like me, she's a bison in Aggie country, or Aggie land as they call it. She got a graduate degree at Howard University, and we've got that HBCU thing in common. And so
Yes.
she's a strong, committed woman to PA education and has been doing it a lot longer than I have, education.
See,
She's
I
been
think
20 plus years.
y'all's classes would be so fun. I know you got to learn.
They are.
But you bring another element. Because remember those lecturers, they would stand up there with the stuffy shirt. They wouldn't even look at you.
Oh, we're not stuffy at all.
At all, honey.
We're not stuffy at all.
You see the spiciness.
There's a vibe in the classroom when I'm there, and my students know this 21 coming in are going to find out I'm not a lecturer that stands behind the podium. I walk around the room.
We're going to call them these 21. These 21.
21 groundbreakers.
21 in 2025. Yeah. Do you tell people to get into the medical field? Do you
Absolutely. Absolutely.
Especially African Americans, because we need more representation.
So representation matters, right? That is not just a slogan. One of the commitments that North Carolina A&T has made as the only PA program in the state housed at an HBCU is to bring people in to that space to train so that they can then go back out and be of service to the community. And so Greensboro, of course, is surrounded by lots of underserved areas, and our students demonstrated in the application process that they are like-minded as we are, and they want to be of service to community. So in order to really fight health inequity and health disparities, you have to produce a workforce that looks like the people in the community. And so that's what we're doing. That's been the primary goal as we were developing the program, to make sure that we have a mission, vision, and values that are in alignment with being of service and taking care of those who are underserved.
Looking like you, like-minded and positive. That's all we
Absolutely.
want. That's it. Because when people say, well, does it really matter?
Oh, it definitely matters. It definitely matters. And you don't want me to start quoting statistics and all of the reports that have been documented and things printed in journals about parity with the provider and with the patient, right? And how outcomes are improved when there is parity between the patient and the provider.
Did y'all hear that? Yay. What's your handles? Can you be social with us? Follow you? I know LinkedIn.
So I'm on LinkedIn. You can find me on LinkedIn.
Yeah.
Donna Felicia Murray.
Doctor. I call her Dr. Donna Felicia Murray. Fabulous child. They grow up so fast, right?
My goodness.
They're like toddlers, and then they're just teens.
And they're grown and shaven. In my kid's case. And ordering wine at restaurants.
Oh, God. We should do a study on, wow, they're grown up now. What do we do?
I know.
Right?
I know what I'm doing. I don't know about you. I'm having more fun now that they're grown than I did when they were. Oh, don't let them hear that.
Why do our kids not want to hear that we're having fun? They're like, ma.
No, I think mine were okay with me having fun.
Okay.
Yeah.
They've seen us work hard.
They watch me. Yeah, that's what I was going to say. They watch me work.
I work so hard. Now I need to have some fun. Yeah. Okay, we're going to talk our kids into We're going to talk our kids into being PAs, physician assistants.
Yeah.
So after they finish their 4 years, because they have to finish their 4 years.
4 years of undergraduate school, any major. Let me just emphasize that. You can go and major in art history if that's what
floats your boat.
But you have to make sure that you take your science prerequisite courses. So major in art history, major in, I usually say basket weaving, but we won't use that one. But any major, but you have to take your prerequisite courses, which consist of your biologies, your anatomy, physiology, your microbiology, in some cases biochemistry, genetics, making sure you got at least a statistics course, a psychology course, and medical terminology, right? You get those courses under your belt and you get good grades. You should be good to go. So let me tell you about the scholarship director portion of my job, which has nothing to do with money. So in the field of medicine where we do research, it is called scholarship. Okay. So those of us who function or work at the master's level or the doctoral level, we encourage, as we have, our students to do research and write articles. So when we are preparing for the research and writing the articles, that in and of itself is scholarship. So as director of student scholarship, my job is going to be to oversee the capstone or research projects that our students will do as a part of their graduation requirement. So that's what that's all about.
I love it. You keep us informed. See, I would want my kid, if they were in your class, I'm like, you're taken care of. See you later. Right?
We're going to make sure that they are good to go and ready for the world when they graduate.
Because your premise or our generation was you take care of them kids as a village.
Oh, yeah, absolutely. Absolutely.
So,
and my village is pretty extensive. I've got graduates all over the country now, and they call me all the time.
I love
I'm
that.
the PA mom, PA auntie.
Her sons say that everybody in the world is in her contacts in her phone because there's no stranger.
Oh, no. And all my PA students are my babies. They know that.
They're babies. What do you eat for healthy food? Okay. And then what do you eat when it ain't healthy?
Oh, goodness. I'm a big salad lover. So, yeah.
Caesar?
Yeah. Oh, with some salmon on top?
Caesar salad?
Some salmon or some chicken. Yeah, that's good stuff.
Speaking of food, she had a birthday party. She always has the best parties.
I try.
This woman has the best doggone parties. I know one of them was at Steak 48. My eyes were bulging the whole time. I'm like, wow.
Oh, that big piece of meat.
Big old piece of meat. It was the best date ever. Dr. Susan.
That was fun. Yeah.
I call her Dr. Allen. Allstate.
Emma Allen.
Emma Allen. It was all the movies.
The best. Not Allstate. State Farm.
State Farm, I said. Not
best
the
State
other
Farm
one.
Agent in the world. Emma Allen. Emma Allen. For sure.
EA. And
Emma has been so supportive of my work too. Let me just say that. In addition to just being a dear friend and my insurance agent, she has been hugely supportive of the work that I have done, both in the community and even now as I've been helping to develop this program.
Got a shout out. Oh, my dessert destination.
Hey, Mary Howard.
Mary, come to the front.
Mary
We got a message for you. You need to get in the car.
Mary does all my desserts and cakes for all of our celebrations.
And she decorates around the cake.
Yes,
so
indeed.
It's not okay.
Awesome.
I could talk to you forever. Awesome. What is the last wise words you have? And do you want another sack? Don't you need these? Don't these?
Oh yeah. If I don't use them, my mom will.
Okay. Oh, how's your mommy? Her mommy's so cute.
Mommy
She's
is
cute as a
Mommy just turned 89. Looks like she's 79.
I was gonna say like 69.
Yeah, and still making up her face. She will use these.
We have to say goodbye to our audience. Thank you for joining us for an episode of Curbside Curiosity. I am your host, Fran Murray. I interview movers and shakers, community stakeholders, and also experts in their field. This is Dr. Donna Murray.
This has been great. Thank you, Francine. Appreciate you as usual.
Smooches. Like, subscribe. We need the followers. Okay, bye.